The second one is prophylaxis, also known as trade name Provolax. The pharmaceutical is SSRI, also known as selective serotonin reuptake inhibitor. The therapeutic is antidepressives. The action is selective serotonin in the inhibits reuptake serotonin in the CNS. The indication is also for patients with depression, OCD, and PTSD, anxiety, and this medication can be taken orally. We want to assess patients' vitals such as blood pressure and pulse. We want to go ahead and assess for patients' behaviors such as mood, nervousness, anxiety, and suicidal tendencies. We also want to we also want to assess for serotonin syndromes such as muscle spasms, involuntary muscle movement, and fatigue and weakness. We want to go ahead and look for the labs such as AST and ALT. We want to go ahead and patient education, tell patient to take medication as prescribed. We want to avoid stopping abruptly because it can be life-threatening. You want to taper down, and that's something you need to go ahead and talk to the doctor about. Also educate patient's family and patient about increase of suicidal tendency, as well as nervousness, anxiety, and depression. Notify the HCP. We also want to educate patient about serotonin syndrome. If they have any involuntary muscle spasms, involuntary muscle movement, and weakness and fatigue, you want to notify your HCP. You want to avoid alcohol and other CNS depressants with this medication. You also want to avoid driving until known of medication because it can cause dizzy and drowsiness. And for the assessment, we also want to assess for sexual dysfunction if that's something the particular that the patient would want to talk to the doctor about, if they're no longer in the mood or for whatever particular reason. And for the assessment, for the patient education, just know that this medication can decrease sexual arousal.